the treatment of hypertension, whether one drug is good, two drugs are good, or should there be a combination? What are these various medications to treat hypertension? So the American Cardiological Society, American Heart Association treatment recommendations say that the thiazide diuretics or calcium channel blockers, ACE inhibitors or ARBs, these are the first line of therapy for treating the hypertension. And then combination therapy if the patient is having stage 2 hypertension, that is blood pressure generally more than or equal to 160 above 100, or the target, if the blood pressure remains more than 20 divided by 10 millimeters of mercury over the target, then you can think of combination therapies. So when various medications have been compared to treat hypertension, all agents had higher risk ratios versus thiazide diuretics, especially the beta blockers. So if you look at the ACE inhibitors, the all-cause death was to the tune of 1, ARBs, that is 0.99, beta blocker 1.1, and calcium channel blocker is 0.97. So basically, if you look at the major CV events, that is cardiovascular events, it is more with beta blockers alone. So if you look at the ASCOT trial, initial hypertension treatment with beta blockers increased the risk in comparison to calcium channel blockers. So if you look at the hazard risk, amlodipine versus atenolol, the stroke, cardiovascular events, mortality and diabetes, if you look at them, it is 0.77, 0.84, 0.89 and 0.70 respectively. The American Cardiological Society comparison review, thiazide diuretics versus other agent for the non-white individuals. So no agent is superior to thiazide diuretics basically here. So is there a preferred thiazide diuretic? If you look at the hydrochlorothiazide, chlorthalidone and metolazone, the protein binding is 40%, 99%, 95% respectively. So no appreciable difference in cost, but chlorthalidone can be tough to find and is rarely combined with other medications such as ACE inhibitors and ARBs. But nowadays with various newer fixed drug combinations with chlorthalidone, that issue has been solved, I guess. If you look at the chlorthalidone versus hydrochlorothiazide, the various effects like diabetes, CKD, acute renal failure, hyponatremia and hypokalemia, if you look at them, they have been comparable. So what about the side effects with thiazide diuretics like erectile dysfunction, hypokalemia, that is low potassium, and hyponatremia, that is low sodium levels? These are some of the major side effects of the hydrochlorothiazide. So TOMHS, that is Tom's study, has shown that incidence of erectile dysfunction is equal to placebo with thiazides. So not a major concern. Erectile dysfunction is a predictor of CV disease. So in somebody who has got a erectile dysfunction with on or off thiazide diuretics, then it can be one of the predictors of cardiovascular events or disease. 5-year risk of the CV event in men with erectile dysfunction is to the tune of 11%.